I'm Philip Ward, Editor-in-Chief of Aunt Mini Europe. Hands-on ultrasound is an important topic this week, not least because the ECR president himself, Professor Durci, is an enthusiast of ultrasound and very much an initiator of the hands-on workshops. So we thought we'd delve into this topic with an ultrasound specialist, Dr. Christiane Nyhsen. Thank you for joining us, Christiane.
Well, thank you very much. I'm very pleased that ultrasound is in the focus because I've been doing ultrasound for many years, and I find it sad that some radiologists want to give up this modality and are happy to give it on to other specialties like internal medicine, gynecologists, etc. But also in UK where I used to work, to give it to sonographers and not really care about it as much. So,
excellent. Well, I think through our brief talk here, we'll enthuse people and make ultrasound very much up the agenda. Let's make that our ambition with this talk.
Yeah.
So first of all, I thought I'd ask you about your session on Wednesday, because it was very well attended.
Yes.
I think it was on infection contamination in ultrasound.
I mean,
Could you tell us a little bit about that, about what you said?
The main session was about fusion in ultrasound and the different aspects where fusion can be used very successfully to guide interventions and for improved diagnostic purposes. And I was asked to then also introduce or reiterate the decontamination issues, which in fusion are even more important because you have more equipment, longer cables, more crooks and creases, more kind of things you're attaching sensor devices,
and mobile devices, I suppose.
Yes, I mean that was not part of the fusion session, but I think it's important to consider decontamination, not only in fusion, but mobile devices are coming up more and more. Newer ultrasound probes are being developed that you can plug into your mobile phone, and we know that contamination is an issue in the hospital setting and in every setting. I mean, it's been in the news, a fast food chain having problems with fecal contamination of touch screens, and we have publications that show that ultrasound probes have got more bacterial contamination than bus poles or public toilet seats. So it is definitely an issue to decontaminate your ultrasound equipment, and should you use a mobile phone and iPad, should you take that to the intensive care unit, is even more important to consider how you disinfect it before and after. And people, I think, we try to reiterate that it's very important, but if you don't keep up the training, if you don't keep up the interest, it slips and everybody is very busy. I think everybody is getting more busy.
I think we all take shortcuts.
Time constraints.
We all take shortcuts.
Easy to slip down again.
But your ESR subcommittee, you've been very involved in guidelines in education. Do you feel the message is getting home? Is you beginning to see evidence of that?
Well, we have done a survey in 2015, which was published in Insights in 2016. We then followed on to Write Guidance, which was also published about a year and a half ago. And they have been very well received, but I think you certainly have to reiterate that, and you have to bring the message across again and again. And the subcommittee is trying to do that, but it's not easy because it's involving more costs, more staff training. It will slow you down. If you then introduce high-level decontamination, you think about buying automated systems, there's definitely cost implications and time implications there. You may have to buy more ultrasound probes. On the other hand, it's definitely a way to go. I think patient safety cannot be compromised, and I think more and more insurers will see that if there should ever arise a problem, more hospitals will consider that as well. This is going to be very expensive, very detrimental to your reputation. So
could you tell our viewers about one or two of the more interesting cases that you've come across, specific cases where you've been...
Yeah, I mean, not a lot of cases have been published, which is quite understandable. If you have a case in your hospital, your legal team, the family may not be happy to have it transmitted all over and to be published. But I found one case with hepatitis C transmission through ultrasound-guided prostate biopsy, and one case in vitro fertilization from one known source patient. 2 women were infected and only one of them was actually symptomatic with hepatitis. The second one was just discovered through screening. And I know of several other cases which have not been published, and I can just reiterate that, we just know the tip of the iceberg. A lot of infection conditions we're not aware of, or they have not been published for various reasons. So it will happen, and there is contamination. There is a risk there. It's difficult to quantify, but
so
I think
constant
an important
vigilance.
topic.
Constant vigilance. I suppose that's the important thing, isn't it?
I think we try to emphasize it.
Anything people throughout this year should look out for? Anything sort of that's coming up in terms of papers, in terms of surveys?
I mean, the ultrasound working group is working on a paper for handheld devices. EFSOM has just published a paper on this topic as well. We looked at fusion imaging, which has just been published, if you look for that.
Excellent.
So it's still, ultrasound is still a very active field, thankfully, and I hope that all radiologists will keep an interest and continue also in this modality.
Well, keep up the good work.
Thank you.
Constant vigilance, I think that's the message here. This is Philip Ward signing off for Aunt Minnie Europe.